Nighttime in a major emergency department. Ambulances arrive continuously, monitors blare, and medical staff rush to stabilize incoming patients. But despite the urgency, this workflow is inherently delayed. Hospitals are forced to operate reactively, deploying resources only after a crisis has already materialized at their front doors. When a sudden surge of patients arrives, the intake process bottlenecks. Without immediate visibility into the true severity of every case, prioritization slows down, and the waiting room fills beyond capacity. This initial delay ripples through the entire hospital. Slower triage means longer stays, which backs up into critical care units. Once ICU beds reach maximum capacity, incoming ambulances are diverted, delaying life-saving treatment for the patients inside. In an environment where survival is measured in minutes, relying on disconnected information and delayed responses puts lives directly at risk. What if a hospital didn't have to wait for the breaking point? What if it could see an operational crisis forming hours before it actually happens? This is MEDIQ AI. It is an intelligent platform designed to transition emergency management away from reactive scrambling and toward predictive intelligence. On this command center dashboard, the platform pulls fragmented data streams, patient totals, emergency cases, and wait times into a unified operational view. On the right, the system parses that data to generate real-time AI predictions and alerts for incoming pressure. Raw data without foresight is just noise. To keep an emergency department functioning, hospital administrators need this unified predictive visibility to anticipate demand before it overwhelms them. The engine behind this visibility operates on a continuous cognitive loop. It monitors incoming data, analyzes the context, predicts bottlenecks, alerts the staff, recommends a solution, and allows administrators to act. We can see this loop trigger the moment a patient arrives. On the AI triage screen, nurses input vital signs like heart rate and oxygen levels. The system instantly calculates an emergency severity index, immediately flagging a high-risk patient as level 1 critical. Instead of defaulting to a chronological queue, the intake logic updates instantly to ensure the most critical patients are treated first. For the rest of the waiting room, the system dynamically calculates the queue. This dashboard shows specific patients prioritized by their risk level, with predicted wait times that continuously adjust based on current hospital resources and incoming severity. By assigning concrete risk levels and forecasting individual wait times, the emergency department can clear intake bottlenecks before the waiting room ever overcrowds. Moving beyond the front desk, we can look at the entire hospital floor plan. This emergency heat map tracks operational pressure in real time, clearly highlighting the emergency department and the ICU in red to indicate critical load. The ICU is often the most constrained resource in the building. On the ICU Intelligence dashboard, we track exactly how many beds are occupied, cleaned, or reserved. But the crucial detail is the AI Occupancy Prediction Panel, warning administrators that ICU occupancy will hit 95% within 2 hours. Having a 2-hour warning to find an available bed is the difference between a controlled patient transfer and a fatal delay. With that warning in place, the system helps administrators respond. On the resource allocation screen, an AI recommendations panel suggests proactively moving nurses and shifting a ventilator from a lower demand department directly to the ICU. Meanwhile, on the clinical side, doctors have tools to move faster. Using the AI Assistant chat interface, a physician can pull suggested treatment options and guidelines based on the patient's context. At the bottom, it explicitly states these responses are for clinical support only. Human professionals must make the final medical decisions. The technology does not replace a doctor's judgment. It removes the logistical friction of hunting for protocols and resources, giving clinicians more time to focus on treating their patients. That visibility extends directly to the patient. Through a dedicated mobile app, individuals can check their health records, track active prescriptions, and view their exact status in the emergency queue, removing the anxiety of a disconnected waiting room. Zooming out to the city level, the Ambulance Intelligence Map tracks fleet readiness. Rather than blindly dispatching the closest vehicle by distance, the system routes ambulances based on live traffic, vehicle status, and current hospital capacity. Inside the supply chain, the Medicine Intelligence screen monitors pharmacy inventory. The demand forecast chart identifies which drugs are being rapidly depleted, triggering risk alerts days before a critical stockout can occur. And looking at the broader public health horizon, the Disease Analytics dashboard aggregates incoming symptoms, By mapping case clusters, it calculates a risk score to predict localized outbreaks before they overwhelm the regional health network. True emergency management cannot be confined to the walls of a single building. It requires a synchronized network, connecting the patient's pocket all the way to the city's supply chain. As this technology scales, the core ethical pillars remain fixed. The AI assists, the human decides, and patient data is strictly protected. We can look back at the emergency department. With these alerts in place, the decision-making process is more targeted. Staff work with clearer warnings, allowing them to coordinate beds and personnel with greater operational awareness. We are moving from reacting to emergencies to anticipating them. MEDIQ AI provides intelligence when every second matters.